Hi, I'm Dr. DeFabio, and welcome to the natural way to better health and wellness. What is that pain? What hurts over here? How come my shoulder hurts? What's wrong with my knee? It hurts. It's my calf. Well, what is it? That's what we're going to talk about today. What hurts? We're going to be focusing in on your tendons. Inflammation of the tendons called tendonitis, degeneration of the tendons called tendinosis, strains of the tendons, and how it all relates to the soft tissues of your body that generate pain. We're also going to be touching on bursitis and fasciitis, about the bursa and the fascia. So it's all about the connective tissue in your body and how it all interrelates to figure out what's giving you that pain that you commonly talk about. So let's talk about the tendons first. What is a tendon? A tendon is the structure that connects the muscle to the bone. So muscles create movement, are very elastic, are like a rubber band. They have a lot of stretching that goes along with them. Then from the muscle becomes a tendon. Look at this picture here of the arm. You can see the tendon is that white area where it attaches to the bone, and then that reddish area is the muscle belly where the muscle is, and then on the other end of the muscle is another tendon. That's your biceps muscle, the forearm. I'm sorry, that's your bicep muscle, the upper arm. So that's what a tendon is. Now, if you look at it a little more closely, we can figure out why tendons get injured a little differently than muscles, but also why they can be slower to heal. Muscle fibers, tendon fibers, it's a group of fibers that join together to create that structure. So if we were to look at all the different groups of fibers that join together to create a tendon, we'll look at this picture here. This picture shows us how the tendon on the outside breaks down to a tertiary bundle, they call it, and then you have fibrils and fibers of the tendon within there getting smaller and smaller and smaller. If you notice, there's a couple of blood vessels in there, but not a lot. And that's something important to remember, that there's not a lot of blood vessels in tendons. So that's the anatomical structure of the tendon. So when it gets injured, some of those little fibrils on the inside can get injured, or some of the slightly larger fibers can get injured, or the whole tendon itself can get injured. And that's where we run into problems. However, we're going to look at this a little more closely than that. We're going to look at the histological, the microscopic evaluation of a tendon, to give you a better idea of how it works. And by the way, tendons and muscles and ligaments share some of these same properties, all right? And we're going to talk about how all that ties together as well. But if we look at this slide, it's a microscopic slide of the tendon, you can see all the fibers run in the same direction. It's a nice smooth orientation. Those little darker spots are the tendinocytes, the cells that create new new tendon tissue. All right? So nice normal alignment, and that's what we want to see. It's called dense tendon collagen in the same planes. If you notice, all the lines are going in the same direction. There's not a lot of crisscrossing. That's what makes a tendon strong. If the fibers of the tendon went one way and then they went another way, it would lose its strength, its tensile strength. It would get ripped and torn. That's why when you get into other forms of repair where the tendon gets injured, you don't get those fibers to line up. We need to keep that orientation of the fibers. So that's what good healthy tendon looks like. Look at this picture. This picture is a degenerative tendon. Notice how the lines aren't symmetrical. Notice how you can't see those nice smooth interfaces and it wavy. And look at all that extra whiteness in there, all right? That's degeneration. That would be what a scar tissue would look like in a tendon. So rather than having that nice, even, smooth appearance, you can see how it's no longer one even, smooth tissue. That's when we run into trouble. When a tendon gets injured, those are the types of changes that occur. So we know that muscles create motion. Muscles attach to bones with tendons, and when the tendon doesn't have that normal elasticity, we run into problems. So what happens when you injure a tendon? Well, it gets injured lots of ways. It can get injured just from microtrauma, overuse, repetitive use over time. It can get injured from a big injury. You know, you threw a baseball and you threw your arm out, well, you strained the tendon of the rotator cuff. And for example, that's what it would look like here if we looked at a rotator cuff strain. But let's go back to having an injury of the tendon, then it's got to heal. So let's look at the phases of healing that a tendon has to go through. And actually, this phase of healing also applies for ligaments, and it also applies for muscles. Initially, you have an injury. Then you have inflammation. And of course, during the inflammatory phase, it's hurt, it's hot, it hurts, it's swollen. So that's the inflammation phase. After that, the second phase of care, we get into the regeneration phase of care. The regeneration phase of care is when those fibrocytes start to lay down new tendon, new fibers, new material to get the injury to re-heal. So we want those to go, again, in the same line. If they start to lay down tissue in different lines, we run into trouble. So we want everything to be linear, all right? But then as it starts to regenerate, then we get into remodeling. And as it starts to remodeling, it gets to lay down higher quality tissue, starts to get the strength back, and it all ties back together. And then, of course, we finish with the end phase of healing. So those are the 4 steps, and if you look at this slide here, we can see as we go right through it. We have the acute inflammation. It says here 72 hours it lasts. And then we get the regenerative phase of care, and that could last for a while. That could last anywhere from 72 hours to 6 to 8 weeks. That's why it takes so long for tendons to heal. And then finally, the remodeling phase, look at that, up to 12 months for the remodeling phase of care. That's why when they say, oh, you're better off breaking your ankle than you are spraining it, that's how long it takes for these things to heal. So injuring a tendon can be a problem. It can be a macro trauma, a big injury, or it could be a micro trauma, a little injury. Regardless, it has to go through these phases of repair. If it heals up normally, you're in good shape. If it doesn't heal up normally, you run into something called tendinosis, which we're going to talk about in a moment. What are your take-homes right now? Your take-homes are tendons have some elasticity. Their fibers normally run in the same direction. When you get injured, it gets broken, and we can see this phase on this slide here. It gets broken, it gets disrupted, and the problem occurs when you get scar tissue. Now look at this. This is scar tissue. Scar tissue, you can see it's not all in the same direction. It's not high quality tissue. That's what makes you at risk for re-injury. So if you've had that injury to your muscle and it keeps coming back, you probably have a pocket of scar tissue down there, and it may be still inflamed too. So just because it's an old injury doesn't mean there can't still be an inflammatory process. So what are we going to do about this? How are we going to treat this? Well, we're going to talk about that in a moment. We're going to take a short break. When we come back, we'll recap about the different types of tendons, how they get injured, and more importantly, what you can do about it. I'm Dr. Donald DeFabio, and we'll be right back. Hi, I'm Dr. Donald DeFabio, and welcome to your ANJC Wellness Minute. It's well referenced in the literature that chiropractic care is very effective for the treatment of low back pain. My guest today is Dr. David Graeber, who's on the postgraduate faculty of the New York Chiropractic College, and let's get some more information on that. Dr. Graeber, back pain, chiropractic, what's the relationship?
Well, Don, most people, when they think of chiropractors, think of back pain doctors. Because there is so much the public with back pain, many people, millions of patients have back pain, millions of people have back pain. It's actually a growing epidemic. Chiropractic care is one of the most effective ways of taking care of back pain. And many people who have back pain come to see chiropractors. Frequently what happens is patients want to know, well, where should I go? I'm hurting. When should I see anybody? Should I just handle it myself? Rub salt on it, lick my wounds. I usually tell patients, when you hurt yourself, if you hurt yourself, I use my 3-day rule. After the 3rd day, if this isn't significantly better, you have to contact someone. You have to get seen, because at that point there is some kind of damage, there's some irritation. It's not just a strain. If they have a type of leg pain or numbness, if that lasts even more than a couple of weeks, they have to be seen, because that is an indication of a serious problem that needs to be taken care of. Chiropractic care, most back pain revolves around poor movement of the spine and the joints, poor alignment of the spine and the joints, and muscle imbalance. Chiropractic care is trained to handle all 3 of those specifically through chiropractic adjustments, through muscle work and soft tissue work, exercise and rehabilitation to get patients better and rapid recovery is the term we like to use.
So the 3-day rule for acute pain or for ongoing pain is what you really want to watch out for.
Yes.
Okay? And then looking at treating not the underlying cause, the joint
Right.
issue, the muscle issue, and then it sounded like for long-term correction you can expect to get some exercises as well.
Yes, exactly. And also chiropractic care is very much on follow-up. We don't like to treat patients and just send them on their way and be left on their own. We like to follow up. We call it maintenance care or just ongoing checkups to make sure, yes, they're doing their exercises, if they need periodic adjustments to maintain their correction, maintain their lifestyle.
Well, it sounds like a plan to me. Dr. Graber, thank you very much for your time. Now you know why chiropractic is a great choice for your low back pain. I'm Dr. Donald DeFabio. Welcome back to the show. So now you know that tendons are supposed to be elastic, and we grade tendon injuries 3 ways. Look at this slide here. You can have a grade 1, which is a mild tendon strain, less than 25% of the fibers were torn. A grade 2 is up to 25% of the tendon fibers were torn. And a grade 3 is, well, complete rupture is what we don't want to do, more than 50% to complete rupture. However, we can still address those with conservative natural means, and we're going to talk about that. So let's take a look at this piece of tape. It's stretchy tape. That's what your tendons are. That's what we want to do, wants to stretch and give. What happens when you have an injury and you get scar tissue in there is this. See how it starts to twang in the middle and it doesn't move? That's a problem. So we need to take this and break it down. So that's where we get in with treatment. The treatment for a tendon strain or a tendinopathy is, number 1, get rid of the inflammation. Remember that first phase of care. We can do that with ice. We can do that with rest. We can do that with nutritional supplements. There's a really good nutritional supplement called Zymane, systemic enzymes. We use that all the time. Decreases the inflammatory phase. You got to get the inflammation down. Then you want to get into that next stage, and there it's important to get those fibers to lay down in the right direction. Mechanical stimulus does really, really well for that. What does that mean? It means myofascial release, active release techniques, Graston techniques. Those are modalities where I can use my hands or an instrument to enable those tendinocytes to lay down high quality new tendon fibers in the right direction. So that's where we get into the repair and the remodeling phase. Then we can talk about strengthening. If we start talking about strengthening too soon in the process, guess what? The inflammation is just going to keep coming back. That's why that tennis elbow keeps coming back. It starts to feel a little better, then it keeps coming back. Why? Because you're using your hand all the time. You're lifting it all the time. You're starting to get out of that inflammatory phase, and then you're starting to use it, or you're doing your exercises too much too fast. Boom, it gets re-inflamed, and then you go back into that inflammatory stage, and it never gets into the repair, remodeling phases of recovery. That's a huge problem. That problem creates tendinosis. Tendinosis is a different type of tendinopathy. Tendinopathy is the big name for an injury to the tendon. Tendinosis means the tendon is stuck in that inflammation repair phase, and it hasn't been able to lay down high quality tissue into that proliferation phase. So the tendon is actually still a little inflamed, but more importantly, it's almost degenerative, and the scar tissue that's in there is very poor quality, very low quality. That's a huge problem, and that's commonly seen. In fact, I've seen tendinosis in a 14-year-old baseball player. Injured his arm throwing in February during winter ball, and then he came in April in the middle of the beginning of his season, and it was still sore. We sent him out for diagnostic tests and confirmed it was tendinosis. The rehab, the treatment for that was extremely successful, but even in youngsters, you can get that degenerative process where the body just can't lay down new tissue. Now, how do you get new tissue to get laid down? The best way to do that is with mechanical stimulation. There are several very good research articles that show mechanical stimulation of the tendon will help the body lay down high quality tissue. I use instruments oftentimes, the Graston instruments, or I'll use my hands. But we do that to stimulate the body to lay down new tissue. And if you do it properly, it won't aggravate the inflammation. If you do it too much, it'll aggravate the inflammation. But that's where my clinical skills come in. The other thing you want to do for tendinosis is called eccentric loading. That's right, you want to challenge the tissues with an eccentric load. When you strengthen a muscle, you have the concentric, where the muscle contracts, and you have the eccentric, where it releases the contraction. Eccentric loading creates more what we call tension over time. There's more tension on the tendon as it lengthens over time, and that makes it work harder. It also helps restore elasticity to the tendon. Remember we talked about how when the tendon gets injured, you get the scar tissue in there and the fibers may not go in the right direction. Well, if you work on lengthening the tendon with a little bit of tissue, with a little bit of resistance, it helps encourage those fibers to line up in the proper direction, and it prevents stiffness. Because what happens when you injure a muscle? It gets stiff and it gets tight. So you want to keep it loose. So let's take a quick look at another slide, and you can see this is what tendinosis looks like versus a regular tendon. Now that you're getting good at looking at these slides, you can see what I'm talking about. When we talk about treating these, again, it's about getting the inflammation down and stimulating the body to get out of that vicious cycle in the inflammation stage and not able to get into the repair remodeling stage. Graston, active release, mechanical stimulus, all work very well for that, and probably it's the best way to jump out of that. Hey, PRP, the injections that the medical docs work, do the same way, all right? It's all about stimulating that laying down of high quality tissue to get it to heal. So tendinosis is a huge problem. It can be more of a chronic problem, but it responds extremely well. Nutrients that you want to use with tendinosis, well, we know that the collagen 1 fibers are important for healing, so you can take those as a supplement. I use the Synovix supplements. It has some glucosamine in there because that also is a good nutrient that helps lay down high quality tissue, and vitamin C is really good. So nutritionally, there are lots of things you can do to help stimulate healing, and of course, you got to keep inflammation down. So that's a lot of information about tendonitis and tendinosis. Next, we're going to talk about bursitis and fasciitis because they all kind of tie together. I'm Dr. Donald DeFabio, and we'll be right back. Hi, I'm Dr. Donald DeFabio with your ANJC Wellness Minute. Did you know that dizziness, vertigo respond extremely well to chiropractic care? My guest today is Dr. Janine Barr, a chiropractic doctor in Sterling, New Jersey, who's going to talk about that. Dr. Barr, what is the relationship between vertigo and dizziness and chiropractic?
That's a great question. It's something that millions of people suffer from, and not only do they suffer, but they really suffer from it, and they don't know what to do about it. The relationship between chiropractic, vertigo, dizziness is such that chiropractic has several ways, several types of therapies, treatments, including adjustments that work very, very well in not only improving the symptoms of vertigo and dizziness, but also in many cases eradicating the symptoms of dizziness and vertigo. And one of the things I wanted to mention too is, what is the difference between dizziness, vertigo, I don't have my balance, etc. They're all different symptoms of a common thing, and that is the way our brain interprets where we are in a three-dimensional space. And it's important to differentiate and have a professional, like a chiropractic physician, determine what's the cause of that dizziness, what's the cause of that vertigo, because it's very, very important to figure that out. Yeah. You shouldn't be suffering in silence, and you should give a call.
Mm-hmm. So it's important that you have an accurate diagnosis.
Yes.
Once you have an accurate diagnosis, what can somebody expect in a chiropractic office if they're experiencing dizziness or vertigo?
Great question. They can expect a very thorough examination that's going to focus on some neurological testing, some orthopedic testing, and some chiropractic testing, okay? Mm-hmm. Because the brain is involved and the nervous system is involved. Mm-hmm. And then at that point, an accurate diagnosis can be made. There may be some more recommendations for testing. There are several different types of diagnostic tests out there that the chiropractic physician can refer for to understand more thoroughly what's happening. You may need it, you may not need it, but that's what your chiropractic physician is there to determine. And once an accurate diagnosis has been made, then a very, very individualized treatment plan can be made for the patient. Some things to do at home that are really effective, some things that will be done in the office that are really effective and important in creating a long-lasting difference.
Excellent. Well, there you go. Dizziness, vertigo, find the cause and get it treated with chiropractic. I'm Dr. Donald DeFabio. Welcome back to the show, and it's all about your soft tissue, tendons primarily. Let's talk a little bit about bursa because they go hand in hand, and fascia. They're all tied together. What's a bursa? A bursa essentially is a fluid-filled sac that's around the joints that acts as a buffer, as a cushion, so that as the tendons attach to the bone, there's a little cushioning between the bone and the tendon so the tendon doesn't rub. I mean, look at this picture here of the shoulder, and you can see the bursa's right up against the bone and then the tendons on top of it, so you can see how they are interrelated and the bursa protects it. The bursa can also get extremely inflamed and sore. You don't get that scar tissue proliferation with a bursa that you do with a tendon or ligament, so that doesn't apply, but it does get inflamed. Look how close the tendon and the bursa are to one another. If one's inflamed, the other one's going to be inflamed. So if the area's been injured, a lot of times they're related. We still have to get everything to heal up regardless. The other thing people talk a lot about is fascia. Fascia is the covering around the muscles. It's very dense, it's very thick. And now look at this picture. What do you notice about this picture of the fascia? It's not all in one direction, isn't it? It's in all different directions. Fascia is like that. Fascia is not for tensile strength or strength when you lengthen. That's to keep things contained. So it's to separate the muscles so each muscle can do its own thing because the muscle fibers are in different directions. However, the fascia can stick to one another between different muscles and then it impedes motion. And the fascia itself can get inflamed and irritated. Plantar fasciitis is an inflammation along the fascia of the bottom of the foot, for example. So fascia can also be treated very successfully with the procedures we use for tendons. However, the goal isn't so much to get the fibers in the same direction. The goal is more to get it released, to get the muscles gliding much better on one another. Again, we often use tools like instrument-assisted tools, the Graston tools, to get in there and to work it out. Breaks down the scar tissue, breaks down the adhesions, we call them, and helps in the case of ligaments and tendons and even muscle to get the fibers running together. Earlier in the show, I talked to you about the vascularity, about the blood vessels in muscles and tendons, and I said, remember that. What I meant or wanted you to remember is that muscles have a lot of blood supply. That's why they tear easy. There's a lot of capillaries, there's a lot of arteries, there's a lot of blood supply. Tendons have very little blood supply. That's why you don't tear them as easily, but also that's why they have a slower chance to heal readily. They heal more slowly because they don't have a high blood supply. Again, Graston, active release, deep soft tissue massage, PRP, the injections the medical docs give, radial corporal shock therapy, they're all designed to do one thing, to get the body through that inflammatory phase, to drive blood to the area, and to stimulate that regenerative remodeling phase of care. Then you add your exercises for strength and power. Sounds like a lot of words, sounds like a lot of information, so we're going to just take a moment and I want to demonstrate how we would evaluate and treat lateral epicondylitis, tendonitis of the elbow, or tennis elbow. So we'll demonstrate that, then you'll have an idea of how it all talks together, and then we'll wrap up the show. Let's take a look at the treatment for tendonitis in the office here. Today we're going to talk about treatment of tendinosis of the elbow or tennis elbow. The tendon in question attaches right in through here. It's a common attachment for several different muscles of the wrist and forearm. And we want to loosen up the muscles in through here and get this tendon to heal, and it runs about from there to there. So the first thing we do is a thorough examination. We've already examined Vincent. We know that it is a tendon injury. Why? Because it hurts with muscle contraction, but it doesn't hurt with passive range of motion. We know that the joint is fully movable and it doesn't need an adjustment. Sometimes the bone right in here, your radius, gets locked up and we have to adjust it, and that alleviates the tennis elbow. But in this case, we know it's a tendinopathy. So we're going to start with a little bit of Graston therapy. Some lotion on the skin, And why do we want to do Graston? Is because Graston helps drive blood to the area, and it helps enable the fibers of the tendon to line up properly, and it encourages a higher quality tendon fiber in through the injury site. If we don't do this, what happens is the tendon fibers don't line up in the same direction. They line up in a crisscross direction, and it creates a very poor quality healing or scar. This creates a very high quality healing or scar. So we want to drive some blood in there and get that to loosen up. And if you notice, it does make the skin a little red. Occasionally it'll get a little bit black and blue, but that's unusual. After we've done the Graston, then we can talk about strengthening the area with eccentric loaded exercises, and we can also support it with a little bit of kinesio tape. So eccentric loading exercises. So the concentric is pulling up. That's what's going to hurt. Eccentric is releasing the contraction. That's what's going to load it nicely for tendinosis. Hold it up, grab it over the top, turn, straighten your arms out, and then slowly eccentrically load that whole extensor group. That is one of the best ways to strengthen this. It's called the Tyler twist, well referenced in the literature. Cock up, grab it over the top, rotate, stretch out, and slowly go down. Tyler twist, we have different colored bands, more thicknesses, so as you get stronger, you use a more resistant band. One of the best ways to strengthen the rotator cuff. So we've examined it, we've treated it. We can also use some really good supplements. Grape seed extract is excellent for driving blood at the microscopic level to the tendon. It has some natural anti-inflammatories. And also the Synovix DJD, if there is any arthritis in the area, it's got some glucosamine, some chondroitin, some vitamin C, some MSM, helps decrease inflammation and drive healing to all of the called collagen tissue down in the area. That's what we want to do nutritionally. And then we finish off with a little home support, some kinesio tape. Bend the elbow. This is a flexible tape. Again, encourages those muscle fibers and tendon fibers to stay lined up in the right direction. Stretch, go down. And this can stay on for 3 to 5 days when it sticks properly. And that's the comprehensive treatment for lateral epicondylitis, tennis elbow. The way we did it here was a blend of physical therapy, exercise, chiropractic, and even rehabilitation. Works great, and you can get rid of that pain in your elbow. I'm Dr. Donald DeFabio. So there it is. It's all pretty straightforward. An assessment of your pain will tell us, is it tendon, is it ligament, is it joint, is it fascia, is it bursa? That's where an examination comes in. After that, we get rid of the inflammation with ice, rest, electrical stimulation, and nutrition. Works really, really well, those systemic enzymes, the Zymane. After that, we get you into the repair and remodeling phases of care. Instrument-assisted soft tissue mobilization using the Graston instruments, using my hands, get those fibers to line up properly. As they start to line up properly, then we want to add exercise. If it's a tendinosis, we go with eccentric loading. If it's a tendinitis, we can just go with light exercises and slowly build up the power and the strength. Lastly, in the final phase of care, and you get the end of healing, we want to make sure there's full elasticity, full compliance within the tendon, and to make sure that it's appropriately strong so that when you go back to use it again, it's not a problem. It's all real straightforward. It's what I do every day. Now you know what your pain is, where it's coming from, and how you're going to treat it. If you treat it right, it's not going to be like that slide in the beginning that said 6 to 12 months. It'll be more like 6 to 12 weeks, maybe less. I'm Dr. Donald DeFabio. Thanks for tuning in.